Hi, this is Dr. Young. Thanks for watching. Today, I would like to talk to you a little bit about Botox and address some frequently asked questions such as how long it lasts, when does it start working, if there's any side effects that you can anticipate, and how do you do aftercare after Botox. Also, at the end of the video, I'm going to show you some diagrams so that you can better understand Botox and hopefully feel more comfortable getting the treatment. So if you have any questions, please reach out to me. I really hope you enjoyed this video, and please like us below. Thanks for watching. Hi, this is Dr. Philip Young. We're Aesthetic Facial Body Plastic Surgery and the Beauty Docs on YouTube. If you enjoyed watching this, click the like button below. Botox Cosmetic is the most extensively studied aesthetic treatment, and it's approved in over 78 countries. It is the only approved aesthetic treatment to temporarily improve moderate to severe frown lines between the brows and in the crow's feet area. Approximately 10.9 million vials of Botox have been sold in the United States since 2002, and it's the #1 selling product of its kind. So right now we're going to do Botox, and I'm going to give you a close-up view on how we do things and talk a little bit about specifics and to give you sort of a better understanding of how we do it and how we get great results. So here we go. Cleaning off any sort of makeup. So the first thing we're going to do is have them make a mean look. Make a mean look, mean. And I'm marking out the medial lines, and I'm also marking out the lateral lines. This shows me where the muscles are acting. So you can relax now. And I always put a middle treatment spot, and then I evenly space them out. Now this will control all the movement going in this direction. It'll relax this whole area. And because the muscles, this whole muscle pulls the eyebrow down in this medial compartment, relaxing this muscle tends to make the eyebrows more want to move in this direction. So it'll make you look more awake, more alert, and less tired. Now, over here, we like to do some lateral injections. Here, and we do about 5 there to really control the lateral eyebrow area, because these muscles also pull the eyebrows down, and when we relax these muscles, the eyebrow is able to come up more here. So relaxing these muscles and these muscles allows the eyebrows to come up more. And over here we do some lateral crow's feet, and we want to evenly space it out from this last line here. I see a prominent vein here. I'm going to avoid that vein, but sometimes you can't see all the veins, so sometimes you will get some bruising that you can't anticipate. And I'm feeling the bone because I want to be a certain distance away from it, or the orbital cavity. And I'll assess it from the front to see if it's pretty even. I see this one's a little lower, because I want to ensure it's symmetry in the face. And that looks pretty even. The muscles in the glabella area, which are mostly pull the eyebrows down. When you relax them, the eyebrows tend to get pulled up. One thing to realize is that there's a difference when you look in the mirror and see the wrinkles versus when you're expressing yourself in a real life setting. In the mirror, you use your frontal volitional part of the brain to stimulate 100% of your muscle fibers. The problem is that when you do this and see no wrinkles in the mirror, in a natural setting, when you use your temporal lobe or your emotional centers of your brain for facial expression, you may look unnatural because the Botox may be too strong. So we feel for more natural results that shifting the treatment strength more to the area under the eyebrows leads to better, more natural results. Currently, we believe to start out with Botox, we like to treat the glabella area with 20 units of Botox and 10 units each in the lateral crow's feet area. We believe this gives great results for over 90% of most people. However, we always tailor things to suit your individual needs. We feel that most people can forego treating the forehead because after treating the glabella and crow's feet areas, the forehead tends to relax. So with this strategic approach, you can get great results and save money at the same time. Here we are treating the lines between the brows and the glabella area, otherwise known as the lemon lines. These injections between the eyebrows will make you feel more relaxed, less tired, and less angry looking. After this, you will then see me injecting under the lateral eyebrows to help lift the eyebrows up. After this, we then treat the crow's feet wrinkles. Now we will answer some basic questions about Botox. First, what is Botox? Botox contains tiny amounts of a highly purified botulinum toxin protein refined from the bacterium Clostridium botulinum. It works at the neuromuscular junction to prevent the neurochemicals from activating the muscle. Does Botox make me look like I've had something done? Well, this is technique based. We have tailored our usual approach to get the most natural results based on our 16 years of experience and from observing results in some of our closest friends and families over the years. In short, you can look natural while looking relaxed, less stressed, and happier. Does Botox treatments hurt? There are many options to decrease the pain of injections. We employ pressure techniques, icing, and we can even use topical anesthesia. 99% of the time, pressure and ice make this treatment very easy to tolerate. What are some side effects from Botox? Well, 3% experience eyelid drooping called ptosis. The good thing is that this is temporary and can be treated with aproclonidine eye drops that stimulate the Mueller's muscle located here. Botox is thought to affect the levator muscle on the more outside location, and Mueller's muscle can counteract the weakness of the levator by being stimulated by aproclonidine. Aproclonidine is an alpha-2 agonist or stimulator that works on the Mueller's muscle, which is part of the fight or flight response. 1% of patients experience eyelid swelling. Other less likely and possible side effects include dry mouth, discomfort or pain at the injection sites, tiredness, headache, neck pain, eye problems, double vision, blurred vision, decreased eyesight, dry eyes, and allergic reactions. These have all been found to be temporary. All of these issues are very rare at our office. How long does the treatment take? This is dependent on the person doing your Botox, but it typically takes about 10 minutes to do. How much does it cost? The pricing ranges from $10 to $20 per unit. The 40 units that we had mentioned above can treat more than 90% of people. So this price range for the glabella and crow's feet can thus be from $400 to $800. As we mentioned before, we can tailor your treatment to whatever budget you have. When will I start seeing results and how long does it last? You can start to notice results within 24 to 48 hours. The full effects can be up to 2 weeks. The results can last up to 4 months. How many injections will I receive? For the glabella area in between the eyebrows, you will typically get 3 to 5 shots. For the crow's feet, it can range from 3 to 7 shots. How long is the recovery time after treatment? There can be some swelling for about half an hour, so the downtime is minimal. Occasionally you can get some bruising, which can last for as long as bruising lasts for you, which can be dependent on genetics, age, the environment, and the specifics around what caused the bruising. Is there anything I should avoid after Botox? Based on the most current literature search I did in August 2017, Jay Carruthers and the Botox Consensus Group showed in 2004 the following. 100% of clinicians said that you should not massage the treated area. Because if you massage the treated area, you can push the Botox to areas that you don't want it to work, and you can get odd results. 78% of the clinicians said that you should actively contract the muscles for 90 to 120 minutes to help uptake and absorb the Botox for better results. Only 30% said limit your activity. Only 20% of clinicians said avoid bending over. Only 20% said avoid exposure to heat, and only 13% of clinicians said avoid flying. Thank you so much for listening. Please reach out to us. We would love to hear from you.
We would love to have you subscribe to our YouTube channel. We're the Beauty Docs. We're going to be coming up with insightful videos showing you a glimpse into our lives in plastic surgery. Specifically, we're going to show you the human side of what we do. Through that, we hope to enrich your life as these experiences have enriched ours. Click the following annotations to subscribe and be the first to see these unique videos on our YouTube channel. To learn about our theory on beauty that helps us get you the best results, To see a new video showing you the relationship between holidays and heart attacks, or to see a story about plastic surgery and hope in our patient with an autoimmune disease who then developed cancer during our treatment. Again, thanks for watching, and we'll see you next time.